We've all heard stories about challenges consumers face when shopping for insurance coverage in the healthcare exchanges. To discover what consumers are experiencing firsthand, we went on the healthcare exchange and searched for basic information about health plans. The Partnership to Fight Chronic Disease, a coalition representing more than 100 different healthcare stakeholders, is focused on raising awareness of the human and economic toll of chronic disease and advocating for health reforms that lessen that burden. For all consumers, but particularly for people with chronic diseases, having good health care coverage is critically important. There are many questions consumers want to answer. Two basic ones are, can I keep my doctors, and are my medicines covered? To see what a consumer has to do to learn about her options, we search for health plans available on Connect for Health Colorado, the state insurance exchange. To search for plans, we had to look under New Customers and then select Shop Now and Browse Plans. We search for plans in Boulder, zip code 80301. We entered a birth date for a 51-year-old and identified as a non-smoker, single-person household looking for health care coverage. 57 plans are available in that zip code, offered by 6 different insurance companies. The website has a link up front to search for providers. We tried the link and found that it allows consumers to narrow search results to just health plans that accept that provider, which is very helpful for consumers. The tool is easy to use and allows consumers to add up to 5 different providers to narrow their search results. We did not find a way to use this tool to search for all doctors in a single health plan. We needed to use our original search results to look for a way to find a complete list of covered providers. First, we narrowed our options to just silver plans, since those have been the most popular with consumers. There are 25 silver plans available. We looked at the silver plan with the lowest premium to find a list of covered providers. There is no direct link to a list in the information available up front. We clicked on the plan name under Plan Details for more information. We had to scroll down to Plan Documents and found a link labeled Provider Network. We clicked on that link and opened a file. The 5-page document that opened describes the types of providers in the network for this plan, but there is not information about how to get the names of providers. There's not a link to find that list, though there is a link to the pharmacies the plan uses. The document also says the plan includes all facilities managed by 2 other corporations and several independent facilities throughout the service area. It's not clear how a consumer can access information about these providers and facilities other than going to the specific corporation websites to search for providers. We went back to the documents. Through trial and error, we discovered that there is a link to covered providers under the Benefit Summary document. That link set us to a new website. We then had to select Find a Doctor at the top of the page. That link led us to a search engine. We had to select our plan type. We then typed in Oncology under Specialty and selected a 15-mile radius of our zip code. That gave us 4 names of doctors. We then tried Hematology and Oncology and got 5 different names. The search terms are very specific and can present challenges to consumers. We then went back to our list of silver plans. and selected the lowest premium silver plan offered by a different insurer. We selected plan details to begin our search for a list of covered providers. We again saw provider network documents and tried that link. Like the first insurer, however, this document does not contain any names of providers or links to a list of searchable covered providers. Again, we tried the Summary of Benefits document to find a link. We did find one and followed it. The link took us to this page. We had to make sure we had the correct region shown in the upper left-hand corner of the web page before starting our search. We selected Find a Doctor and followed the links to a search engine for covered providers. Before starting our search, we needed to again select the plan type up front. We tried zip code 80301 and selected cardiology under specialty, which produced several choices. The ability to narrow health plan options up front to those accepting certain providers is a great feature for consumers. Searching for a list of covered providers under a specific plan, however, required several complicated steps and a few dead ends before finding the information we needed.